Fox 5 Morning News at 7.
Well, not all blemishes are skin deep. Here to share what your skin is really sharing about your overall health, Dr. Chaffoo, good morning. Good to see you.
Good to see you too.
The role of, isn't the skin like the largest living?
It is the largest organ of our body.
Yes.
I mean, literally, it covers our body. It's the way that we interact with the world. So, and it has such important functions, Shally. It's responsible for protecting us against any environmental pollutants, any bacteria, any viruses. It's also really important in terms of water metabolism, you know, making sure that we actually can bring water in, and also in managing our heat. So it regulates our body temperature. If we get too hot, we sweat. So it's a very, very important organ.
Are there conditions that could happen to your skin that you need to say, uh-oh, this could be telling me something more about my body?
Yeah, so interesting. One of the most common things are these little skin tags that, you know, many of us get in little creases
I
on our
have
neck
one of
and other
those.
places.
Okay, what are those?
Right. Well, they're quite benign, but there is some evidence that multiple skin tags may indicate a problem with glucose metabolism. So you might be pre-diabetic. It's not that everybody has a little skin tag should run out and worry they have diabetes, but there is a higher association of multiple skin tags throughout our body and glucose metabolism problems. At the time when you want to get in to see your doctor, maybe get an A1C, look at your blood sugar, see what's going on in that situation. Because sometimes really the skin we can think of as also a mirror into the rest of our body. So what's going on in our skin may indicate something more serious going on below the skin surface.
I don't know if this is like serious. I went camping over the weekend. My skin felt so dry, and I felt like it was a direct reflection that I was just dehydrated,
that's a great, exactly, because what happens is, you're right, what happens is, you know, the way that we handle our water metabolism is through the pores of our skin. So if the skin is very, very dry, then typically we will lose a lot of our, what we call insensible water will come out through our skin. We'll get quite dry, and one of the early signs of dry skin is that skin's itching and begins to flake and peel. And those are indications, Shally, that you really need to replace the fluid that's lost. So the important thing we've said over and over on the show is at least 8 8-ounce glasses of water a day. Really, I know, hard to remember to do that. Many of us have a lot of caffeine products which can make us more dehydrated, but it's certainly something to keep in mind, especially in these winter months when it's so dry, cold. You know, we're cranking up the heat, the air is dry, we're taking a lot of hot showers. Our body just tends to be a bit more dehydrated this time of the year than, say, in the summer months.
What does adult acne? Well, you know, adult acne different than children acne, but
we always think of acne in children, in childhood, right, or in teens, but it can certainly occur in adults. It may be just an indication on occasion that there may be some underlying hormonal disturbance. So there are certain conditions in women called PCOS or polycystic ovarian syndrome. This may be a sign of a metabolic imbalance in our hormones, but the treatment is quite similar. So the treatment for acne would be using topical agents, washing our skin, but remembering that there are some people believe that there may be association of acne with stress, with some dietary products. So we got to be careful kind of what we eat in a sense.
I share a personal story. So there for years, and even as an older woman, I would get very almost like cystic acne around my chin. And do you know where I was able to peel that back and find out what it was? It was milk. It was dairy that was doing it. And the second I cut it, everything cleared up. And it was amazing that the latte or whatever I was drinking a day was contributing to that.
It really does, because, you know, we know that these are inflammatory-like agents. Like we do know that milk, dairy products, certain citrus agents can irritate our skin. This is believed to be part of where these autoimmune disorders like eczema and psoriasis can be related to. The types of foods that we eat can actually stimulate that. So watching what we eat, being a good detective as you were, can make a huge difference.
Love it. And then we got help from Dr. Chaffoo to help us go be a detective. Thank you. Always good to see you.
Good to see you too, Shally.
All right, we're going to take a short break. We'll be right back. It was the milk.